Okay, so hello, Ahil, and thank you so much for joining me to discuss all things related to I guess, the difficulty in terms of fertility and especially surrounding the practices that you work with as well. So, would love if you'd like to maybe just give a little bit of an intro to yourself.
G'day everyone. So my name's Ahil. I'm a naturopath and acupuncturist, and so I work here in my private clinic, which is in Matraville, and then I also work a few days at a community clinic in Bondi. So I work with people with a wide variety of conditions, from musculoskeletal issues like back pain and tennis elbow, to digestive issues, skin conditions, hormonal imbalances, fertility, a whole bunch of different things. And, my ultimate goal, my vision is I want to help to integrate acupuncture, herbal medicine, and Chinese medicine into the kind of mainstream system.
For sure. Thank you for that, Ahil. And yeah, it's like if for anybody who knows me out there, and they know that, the whole scope of fertility is such a passion topic for me because I can really relate to it because I went through it myself as a woman. And I guess my partner and I, just to give a little bit of context, we went through a number of years trying and nothing really worked for us. I had endometriosis, so I had that removed, but also had tried IVF a number of times, which didn't work for us either. And then I just started intuitively wanting to discover something else and looking at different options because I guess I came to a point where I felt really disempowered as a woman. I was hitting 40 and being told that I'm very old, the clock's ticking, that my eggs are there's very few eggs left, my ovaries are lazy, all these type of things that felt really disempowering for me as a woman. And I just intuitively wanted to go down my own path and discover what else is out there, like what other there has to be other options because I knew innately I was going to be a mom, whatever way that was going to be. And then I discovered acupuncture for fertility as well as Chinese herbs, which brought us the most amazing outcome within 3 months of treatment. So I just really want to use today to be able to share your wisdom and your knowledge, just to plant the seed and to give people the information so that they may resonate with this, and just for them to be able to do what they want or what they feel with this information, but just to know that there are options to explore. If one door is not opening, please know that there are other doors to open as well. So with that, would love to just get stuck into some questions with you around I guess, the landscape of infertility. And I know that word, even in itself, is a bit of a tricky one because I feel it's used a lot and sometimes unnecessarily. Like I was kind of told I was infertile, but I feel perhaps nobody's infertile. It's just a matter of getting the correct treatment to bring everything back into balance to be able to conceive, which happened for me. So I'd love for you to be able to just maybe talk a little bit about unexplained fertility or the difficulty in conceiving, and what's, I guess, I have the most common symptoms that you're seeing in your patients at the moment relating to this.
Yeah. So by definition, unexplained infertility is you've been trying for 12 months without any success, and there's no reason. There's no structural issue, there's no hormonal issue, everything's in balance on paper, but still you're not able to conceive. So that's the kind of definition. And the differentiation between infertility and unexplained infertility is 12 months trying without any success. There might be reasons. Unexplained is there's no biomedical reason based on the Western point of view. So the other part of your question was about the symptoms, most common kind of symptom picture I see. Um, so usually with Chinese medicine and naturopathy, people are seeking us usually further down the track. So, they've been through the whole medical mill, they've seen GPs, they've seen specialists, they might have seen other naturopaths and acupuncturists as well. They've tried everything. They've tried all sorts of therapies. I hear about new ones all the time, but just with no success. So that's and it's hard to give, I guess, a typical symptom picture. Often the story is quite similar in the sense of, like, they've had multiple rounds of IVF, they're getting older, there's pressure, and they're just not successful in conceiving, or they've had one and they're looking for a second.
Mm. So I guess in terms though of the possible causes or the underlying factors that we're not conceiving, like what do you feel these are? Some of these, I don't know, are they imbalances or what's happening? Is it stress, the environment?
Yeah, so I think, yeah, there's quite a few different things. There's the kind of structural pathologies, things like fibroids, endometriosis, polycystic ovaries. Then there's hormonal imbalances. There's levels out the follicle stimulating hormone, the luteinizing hormone, estrogen, progesterone, etc. And then there's also the environmental factors. So the stress, the pressure people feel, the lifestyle things, if you're overworking, we say it depletes your yin
Mm.
in Chinese medicine. So if you've been overworking for a very long time, those hormones, that yin, is quite depleted. So there's all these kind of aspects that need to be addressed as well. The stress, the tension, then the possible structural issues, as well as the hormonal issues as
Mm.
well.
Okay.
Yeah. Does that make sense?
Yeah, for sure. And I guess in order to continue on this path and to understand then, so if somebody was coming to you for treatment options for, say, unexplained infertility, can you maybe talk us through how does that process look like from initial consultation and, you know, just how the practices such as acupuncture and TCM work? Like what's the science between it or what's happening? So if you could just talk us through like from the process from when a client comes into you with these types of, infertility issues or difficulty in conceiving, how would you approach that?
Yeah. Yeah. Awesome. So usually people, when they come in, they've done all their tests. So it makes our job a lot easier. So they'll come in, we'll have a chat, do the consultation, take our time to really find out what's going on from our point of view. And usually they'll have already done ultrasound. They'll might have done laparoscopies or all the blood tests, genetic testing, everything. So it makes our job a lot easier because they've got that. So if there is something, it makes it easier for us to address. And if
Mm,
there isn't something, it also makes our job easier because we know they've done everything. So now we can just kind of go with our Chinese medicine naturopathic approach. So yeah, when people come in, first thing, have a seat, have a chat, see what's going on, get the whole picture. Sometimes it can take about half an hour, sometimes longer. And then it's about diagnosing the symptom picture, the tongue, the pulse,
mm,
and then doing a treatment. So usually acupuncture, and then providing some sort of prognosis. So, okay, this is going to take X amount of time in order to
mm.
treat. This is going to take 10 treatments. This is going to take a month or 3 months, depending on exactly what the issue is. And then it's just about following that treatment plan and adapting as things change.
Sure. And I'm so fascinated whenever I have acupuncture and whenever I did during my own treatment around the tongue and the pulse diagnosis. So what are you picking up whenever you're receiving that pulse and when you're looking at our tongue? What information, what intel are you getting? And what are you looking for?
Yeah. So with the tongue, so end of the day, it's all about forming like a complete picture. So you got the symptoms and the history, and then you got the tongue. So the tongue gives us information based on the body as well as the coding. So the body of the tongue can tell us about the blood, the color of the tongue as well. Is there any anemia? Is there any stagnation or pathology? And then any particular areas that correspond to the different organs that might have, say, a crack or teeth marks. And then the coding also gives us a different set of information. Okay, is there what we call dampness? Is there a metabolic issue going on? Is there a lack of coding? All of these different things give us different information to put into that picture. And then the pulse side of thing, so with the pulse, we have 6 different pulses. We feel the radial pulse, but at 6 different positions, 3 on the right, 3 on the left. And these correspond to the different organ systems. So we can get an information about what's going on internally. So, we're looking at the rate, we're looking at the speed, we're looking at the quality of the pulse as well, and then also the specific positions relating to the organs.
Because I know the organs, I'd love you to touch on that. The organs are very much related to fertility as well. So our kidneys, and can you maybe explain a little bit about that?
Yeah, yeah, I can. For me, I always try and give it as kind of Western as I can because it's really easy to kind of go down the esoteric path because
Yeah,
Chinese medicine, it's an energetic medicine. So it's
totally.
like, but if I say, okay, you got kidney qi deficiency, it doesn't really mean anything to people. Whereas if I
Mm,
say, okay, you've got an adrenal weakness or
mm,
adrenal hormone insufficiency, then people can say, okay,
mm,
so like trying to create those connections. In Chinese medicine, all the elements, all the organs have interrelationships.
mm,
So for some people, it's okay, a spleen, a metabolic issue. For some people, it's a liver, which is the
mm,
autonomic nervous system. People holding themselves really tight. That's not creating good circulation, it's constricting the circulation. Then it can be kidney, which is, we'd say, connected to the adrenals and the hormones. So there's a weakness in that respect, which is very common. That's probably one of the most common symptom pictures we see is one of the kidney deficiency and adrenal weakness. Yeah.
okay.
So
So
those would be, I would
fascinating.
say, the main 3 organs would be the spleen, the liver, and
Mm,
the kidney from Chinese
okay.
medicine point of view.
Okay. And we talk more about getting into the intricate details around the Chinese herbs that you prescribe, like how they can help with our different organs and so as well to bring everything back into balance. But we'll talk about
Yeah.
that a little bit later. I guess, in terms of whenever we are trying to fall pregnant, I know that we need to kind of adapt perhaps, better lifestyle choices. So is there maybe three lifestyle choices or key changes that you feel are important in order for us to be able to have optimum health when it comes to our fertility?
Yeah. So the 3 things I would say, so first thing would be adequate rest
Hmm.
and, taking time to just kinda just chill out. Because
Mm-hmm.
especially with fertility, we say there's a yin depletion. And what a yin depletion means, yin is the hormones. And those hormones from a Chinese medicine point of view can get depleted if we're overworking. It
Mm,
damages the yin, the structural element of the body. So by having adequate rest, you can nourish yin. So say you've been pushing yourself for 30 years, 40 years, you've depleted your yin. So we want to nourish that and restore that yin through rest. So that would be the
mm,
first thing. Second thing would be stress. So the stress side of things. So when we're holding ourselves all this tension, it
mhm,
obstructs the flow of the qi and the blood in the body. So having these kind of relaxation practices as well, some sort of process and the habits, meditation, qigong, all that kind of stuff to release that stress. And the third thing would be just kind of just keep it simple and just like chill out because fertility it's complicated, but it's almost made overcomplicated. Like people will come in and they're taking like 20 different supplements and they've got all this different advice and they've got this massive like routine. And there's cases I know where people, they just minimize and simplify the approach, taking just the
mm,
supplements you need, maybe some herbs, some acupuncture, and just keep it simple, don't worry about it, just have sex every 2 days. Don't need to worry too much about the timing. And then, they've been trying for years and all of a sudden they fall pregnant. And it's like,
mm.
what happened? But it's really just, you keep it simple, chill out, and not for everyone, but in some
Yeah.
cases, even that can be enough to get the job done.
For sure. Yeah, and it's so overwhelming. There's so much information out there. And I guess, we just want so much to be, parents, and we'll do whatever it takes. So we'll try everything and anything, we'll see whatever sticks. But just I'd love to hone in on the and address, stress in a little more detail, because I know, as you mentioned, our yin depletion, and there's so much yang energy, we're constantly doing and moving and just not being present and not really slowing down, and just, that's also got to do with a lot of the demands of society at the moment, and a lot for us women as well. We're in such a masculine energy so often now. So I'd love for you to be able to address stress and how that affects, I guess, our ability to be able to conceive, and our fertility health a little bit more, if you could.
So with stress, in Chinese medicine, we say that stress affects the autonomic nervous system. And the autonomic nervous system is representative of all the muscle, particularly the smooth muscle of the body. So when we have stress, the autonomic nervous system will respond by contracting. People get really tight. It can affect the neck and shoulders. It can affect the digestion. It can affect all the organs, actually. So that is one of the main processes that happen in how stress affects fertility. That tension, you know, that pressure. So having practices is really important. Herbs can absolutely help, but also having that practices, the foundational things, can really just help to prevent that from occurring. Yeah.
So important, for sure. And just such an just for anybody who's going through IVF at the moment, I know that when I was receiving just my acupuncture, there was lots of beautiful women coming in, and they're going to get their egg collection, and they'd come in for acupuncture beforehand to help with that process. So can you explain a bit how IVF and sh- uh, acupuncture works hand in hand?
So there's actually been quite a bit of research on acupuncture and IVF. So what's often done is you come a week before the embryo transfer. You'll um, have a treatment half an hour before the embryo transfer, and then you have a treatment half an hour after the embryo transfer. And there's quite a bit of research on this and showing that it has a significant effect in balancing the hormones, as well as reducing the stress and anxiety that comes before having the actual process done. Yeah.
Mm, okay, amazing. I love that. And with regards to stats that you just touched upon, is there any success rates when it comes to using alternative therapies that you could provide? Um, because I know
I would
there's
say
not as much as we want.
Yeah, I would say with alternative therapies in general, not really. There
Yeah.
isn't, as far as I know, any kind of big cohort studies or, prospective research showing that. But there is a lot in the realm of IVF and
Mm,
embryo transfers, especially. There's a lot of research that's gone and a lot of funding that's gone in, and really showing that acupuncture can really assist in the IVF process.
mm, for sure. And I've heard so many stories. I'm a testament to it myself, after 3 months of treatment, and I was 40 at that time as well. So I'm just such a huge believer. And just again, this is why we're doing this, to really just help to plant the seed and help people to be educated and informed, so that they can make the decisions and just explore a little bit more if they're kind of on this journey as well, because it is a difficult journey for many of us. But I guess just diving a little bit deeper into, I guess, introducing herbal medicine and acupuncture to our sister fertility journey. So, what acupoints and what meridians are you focusing on? Can you tell us a little bit about that? And what is happening in our body when these little needles are in our meridian points? What's happening?
Yeah. So the points really differ person to person. There's
Mhm.
general prescriptions that are given. There's quite a few fertility clinics that just use these kind of typical points. Like, okay,
Mm,
spleen 6, governing vessel 4, conception vessel 6, spleen 4. All these typical points that have been researched.
mm,
For me, in my clinic, I don't do that, though I might use these points it really differs person to person because you can do this kind of one size fits all approach and it can work, but it's not going to work for everyone. But if you can give a specific individualized approach, then you're far more likely to have good success. So, yeah, it really just differs person to person, the approach.
Mm. And what's in terms of the needles when they're in, can you just I know it's all energetic work and it's working with our energetic system, but can you kind of paint a little picture of what's it actually doing? What's happening through an acupuncture session when you're lying
Yeah.
there? What's going on internally?
So there's two aspects. On one aspect, we've got the kind of physiology in terms of,
Mm,
okay, we want to balance the hormones, we want to boost the person's energy, we want to get the mitochondria working better, we want to improve the adrenal function. That's one side. And then we've got the kind of energetic approach. Okay, this channel is deficient, or there's a
mm,
blockage in this energetic channel. Like, okay, the heart channel, okay, it's affecting the heart. It goes and leads to that. So by impacting that, we can also impact the organ. So if there's a blockage in that channel, we want to remove the blockage. If there's a lack of energy in the channel, we want to boost the energy as well. So those are the
okay.
kind of two things that we're doing.
Amazing. Okay. That's good to know. Wonderful. I love that. And with regards to the Chinese herbs, and so what's in the Chinese herbs that you're prescribing? I know every plan is going to be very much tailored in terms of that individual, but what's the type of herbs that you're prescribing? Because I know whenever I get mine, they're all in Chinese, and I look them up because I'm just so intrigued by what am I ingesting? Like, what is this stuff? I know it's working, but what is it?
Yeah. So yeah, like you just said, it really differs person to person what we're
Mm,
using at the end of the day. Because, like, for example, if someone's got, say, endometriosis, then potentially we want to use kind of stagnation moving herbs.
mm,
Whereas, say, someone is really anemic, really weak, we want to use the opposite blood strengthening, chi
mm,
strengthening, energizing herbs for the person. Someone's really stressed and tense, we want to
mhm,
have chi smoothing herbs, things that just help the person to relax, shen or spirit calming herbs as well.
mm,
So it really just differs. The formulas we use, though there are very commonly used formulas, we tend to use a lot of
mm,
relaxing and tension releasing formulas, a lot of energy boosting formulas as well. We
mm.
want to tailor it person to person as much as we
Sure,
can.
sure. And I love that approach that it's so tailored rather than just giving a blanket treatment for everybody because that's just not the way it works and it's not the way it should work neither. Um, but in terms of if somebody was coming for acupuncture for fertility, how often would you recommend them have a session?
Usually weekly.
Mm,
Yeah.
yeah.
So before falling pregnant, depending exactly what the situation is, it's usually 1 to 3 months. We want
Hmm.
to optimize everything. And then when they fall pregnant, we want to give them weekly treatments to help their body be strong and help to maintain the pregnancy. And then if they want, week 38, week 39, we can also do induction treatments to help move
Mm.
things along.
That actually was taking me on to the next segue, which was around maintaining the pregnancy, but you've just spoke about that. So it's really strengthening and helping the baby and or sorry, the fetus and also the mother as well. Is that correct? So it's just yeah, building that
Yeah.
that
So
yeah.
with the maintaining, um, what we want to do is we want to strengthen the two organs that are responsible for energy production,
Mm,
which is the digestive system and the
mhm,
respiratory system. That's where we're
mm,
getting our energy from day to day. So the lung and the spleen in Chinese medicine.
okay.
So by strengthening those organs, the
Mm,
mum has lots of energy, so has enough energy for the baby as well.
okay. I love that. I haven't heard that before, so that's fascinating, but it totally makes sense with regards to the respiratory system because that's where we get our energy. So yeah, wow. Learning something every day. And with regards to lastly, I know that you just touched upon it as well. around inducing pregnancy. So could you talk a little bit about that, Ahil, in terms of if yeah, what does that look like? Because I know whenever people are wanting to be induced or they're coming up to their date, they can have acupuncture to help assist with that journey. So what does that look like, and what is the acupuncture doing to help induce?
Yeah. So usually people will come week 38, week 39, sometimes week 40, and the acupuncture essentially is we're trying to stimulate oxytocin. So this is a very well researched area as well.
Mm,
And these acupuncture points, you should not touch them at all until this date. These are all the ones that you should not use for
mm,
pregnancy because what we're doing, we're descending all the chi of the body. So if we do them at the wrong time, they can cause a miscarriage potentially. But at this time, we want the chi to descend. We want the brain to get that message, okay, produce the oxytocin and get that positive loop going to produce more and more and more oxytocin, induce the muscle contractions and help the baby to move. So, yeah, oxytocin production is the main thing. And yeah, I was actually just reading a study comparing the chemical induction using oxytocin compared to acupuncture induction. And it was quite close. With the chemical induction, there was a 70% success
mm,
rate, and the acupuncture, there was a 72% success rate.
mm.
So they're very comparable. Yeah.
Sure. Wow. That's interesting. Great stat to have as well. And I guess finally, Ahil, do you have any other, I guess, last words in terms of advice for anyone who's, on this journey and, maybe wanting to have conversations and exploring, other options, like perhaps, maybe booking in a discovery call just to speak with someone like yourself, just to explore, like, you know, what the process looks like and so on, and just to be more well informed. But if there's any other like last words that you might have, or any guidance or advice for anybody on this journey, or thinking about, if they're not being able to conceive naturally and they've tried different like IVF and so on and it hasn't worked for them, what advice would you give?
Yeah. So two main things. So first thing would be to kind of optimize things. So as an example, like we want to try and address any underlying pathology first before we fall pregnant.
Mm,
So, um, for example, say someone's got like endometriosis.
mm,
We want to take that time before falling pregnant to address that. Because, say, someone does fall pregnant, hypothetically, and they've got the endometriosis and the baby together, it can
mm,
create a lot of issues. And it's very difficult to address using acupuncture. Because for endometriosis, usually we'll use blood moving herbs. But if there's a baby sitting next to it, moving the blood is very risky and very dangerous. So, infertility, we always want to optimize and provide the best situation for the whole time. So I would say take that 1 to 3 months beforehand to optimize everything,
mm.
and then just get regular treatment just to chill out and help to maintain the pregnancy. That would be the first thing. And the second thing is, just for a lot of people, infertility, they just need to keep it simple. Like like what I was saying before, just chill out, have sex every couple of days, don't worry too much about okay, ovulation day 14, this time I need to do this. Just kind of chill out, keep it simple, and even that can make a big difference for a lot of people. Take the pressure off yourself.
Sure. And yeah, and I know it can be very regimental, and we're very like structure, especially around the ovulation time. Been there, done
Yeah,
that,
and
wore
that,
the
that can
t-shirt.
wo- and that can work for some people. That
Yeah,
really can, but there's
yeah,
other people that is part of the
yeah,
problem.
yeah.
So it's a
And
matter of
just
experimenting. Yeah, if that
yeah,
hasn't
and just
worked for you, try the other way.
Yeah, for sure. It's all around the pressure and coming back to that stress element and like being so like just sometimes we need to let go a little bit and loosen those reins because we're so trying to control everything. And sometimes we need to just get out of the way to let the universe do its thing as well. And I guess if anybody, was having conversations with their GP or their health profession, what kind of questions should they be asking at this stage? Like, to get maybe pathology tests done, or what do you think are some good first steps just to be able to feel empowered and informed and take those first steps?
Yeah. So the first steps would be getting blood tests, getting ultrasound, outlining any potential pathology that might be inhibiting the process. And then the other thing would be to kind of ask your GP, okay, are there any other options you recommend? And acupuncture is becoming quite well known for fertility. There's like a big thing going at the moment. In fact, there's a center in Alexandria I was in a couple of weeks ago where they have nurses, they have doctors, they have acupuncturists all within the same center. So it's quite well known. Like I get quite a few referrals from midwives nowadays
Mm, because
because they're telling their patients, go see an acupuncturist, help with the pregnancy, help with induction. So I would just ask, if the GP has any other recommendations, because there's a lot of research and there's a lot of widespread knowledge available. Yeah.
absolutely. Yeah, so couldn't agree with that more. They definitely Western and Eastern needs to work hand in hand because they're so complementary to each other. It's not one versus the other. They should definitely be working hand in hand. So, yes, I
Right.
definitely praise praise that as a testament here. But thank you so much for your time. I just love speaking about this to yourself and different practitioners, even within Bodhi. And it's a massive why of why we co-created Bodhi, because we just want to help inform people so that they know about this information so that they can make the decisions that feel right for them and that there are options to explore. So thank you so much for
Oh, thank
today, but
you.
also for the incredible work that you do. It's incredible work, and you're helping so many people. So appreciate it, and we'll share your details as well. With when we put this out. So thank you so much again, and really grateful for your wisdom and sharing it with us today. And so thank you again.
Thanks. My pleasure. Yeah, that's what it's about. It's about educating the public for people to know there are different options. If you've got back pain, you've got the option of taking a painkiller or having surgery, but there's other options. Physiotherapy, acupuncture, chiropractics. So I think it's just having the knowledge and sharing that knowledge that there are potential other options. By all means, go for a painkiller. That's totally fine. But just
Yeah.
know there are other avenues if you want to explore them. Yeah.
Totally.
So
And that's the
totally
main
agree.
message. Yeah, because I guess at the end of the day, ultimately, we only know what we know or what we've been told. But it's just great to be able to understand that there are, more resources out there to delve into and dip your toes into as well. So yeah, that's what we're all about. So thank you so much again. All
100%.
right,
Yeah, yeah.
thank you,
Pleasure.
Ahil.